Good morning. It is Monday, October 18th. Welcome into the Morning Medical Update. We are live here inside the Dolph Simons Family Broadcast Studio. Thank you, everyone, for joining us on Facebook and on YouTube. We are glad you are with us this morning. Halloween is all about candy and fun, but with COVID-19 and some things that you might not have thought of, the day could turn from fun to a nightmare pretty quick. So we're going to break down the calls that the Poison Control Center receives every October 31st. And we're going to also hear from Sunnye on how to keep safe and, of course, have fun during this huge candy overload. But first, we're going to check in with Medical Director of Infection and Prevention and Control, Dr. Dana Hawkinson. And before we get to the numbers, Doc Hawk, we woke up to the news this morning that Colin Powell, he was the first African-American Secretary of State serving as the 65th under the Bush administration. He has died of COVID-19 complications. He was 84 years old. So kind of help us understand kind of what that means when you take into account he was fully vaccinated, according to the family. We take his age and his vaccination status into account. I think when we hear of someone we all know of, a celebrity passing away of COVID, it kind of brings it to the front of our minds. So what kind of help us understand that a little bit?
Yeah, he certainly was a great civil servant. But again, he was also 84. Don't know any of his underlying medical conditions. So he would have been in that that category of getting a booster or additional dosing. So we hope that everybody who is that 65 and above or has comorbidities or high risk for exposure either through work or other ways to the disease gets those additional dosing to help continue to protect. But again, we know that these vaccines are not 100%, but they still have extremely high efficacy in preventing hospitalization, severe disease, and death. We do have to take into account age, comorbid conditions, and things of that nature. But it's unfortunate. I think this is just one more story. This is a very public story of a great civil servant, of the fact of that we are having excess mortality, excess death, and excess illness in the United States, in the world really, because of the pandemic. But we know a good way to help prevent that, and that is through vaccination.
And the family put out a statement today saying that we want to thank the medical staff at Walter Reed National Medical Center for the caring treatment. We have lost a remarkable and loving husband, father, grandfather, and a great American. And that's from the Powell family. So thoughts out to them today. As we know, it is tough to lose a family member to COVID-19. I want to find out what our numbers have been like over the weekend. What do you have?
Yeah, we have here at the health system 22 active infections, with 6 in the ICU and 2 on the ventilator, and 30 in that recovery period. And of those 22 active infections, 2 are vaccinated. 1 is fully vaccinated and here with worsening symptoms, does have those comorbid conditions that we were talking about as well, those other illnesses, chronic illnesses. And then one of those patients that is fully vaccinated is also here for a entirely other reason, not COVID related. So they are fully vaccinated. We'll keep a status on them and see how they do.
All right, good to see. Did you have a good weekend?
Yeah, it was good. It was relaxing. I also should state that Hayes has 7 active patients and 7 in that recovery as well for 14 total. So.
Great. Thanks for getting those in for us. Okay, before we start our conversation today, do we have any reporter questions on the line?
Sure. Good morning. Cody Holyoke with Channel 9.
Hey, Cody. Good morning.
Hi, everybody. Happy Monday. Was watching the Sunday talk shows yesterday. Arkansas's governor was on Meet the Press, I think, talking about state or federal vaccine mandates. And he's a Republican, but was kind of walking the line here saying that state or federal mandates push vaccine hesitant people maybe in the wrong direction and slow down acceptance. And I know this is taking off the political hat and putting on the healthcare hat here. What are you seeing in our area where there are private mandates in place? There are a couple local mandates. Why do you think people are still hesitant in our area? And what's being done to kind of change hearts and minds? What are you seeing behind the scenes?
Yeah, and I don't know about that. I think that opinion may be more uninformed by the data. From what I've seen from private entities, especially health systems that have mandates and other private entities, yeah, there are some people that have kind of either been fired or terminated or left those positions. But in general, I think they are still having very good uptake for those private institutions. But I think there could be, depending on what you're looking at, data points all over the place. I think we just got to continue to either, again, if you're a private business, making a mandate or making those restrictions is entirely up to you and your leadership. We do know medically, like we said, what is the best way to prevent this excess death, excess mortality, excess illness, stop days of missed work, and that is by getting the vaccine into the arms of those employees. And so from a medical standpoint, obviously we know what the best direction to go is. And we've also seen those stories about the fire workers, firemen's union, and the police officers' unions, and a lot of those people who are exposed to illness on a daily basis refusing to get it. But we know that the devastation that the illness has caused within those ranks of death and loss of work, hospitalization, all that stuff. So again, we know that medically the vaccination is the right thing to do to keep people at work, to keep them, reduce their risk of going to the hospital. So we'd certainly back it again from the medical standpoint. And I don't know if our guest today has any thoughts as well.
Dr. Steven Thornton, good morning to you.
Good morning. Well, I would echo Dr. Hawkinson's statement that like you said at the beginning, it's not perfect, but it's the best thing we have, and that we should be doing the best we can. And getting the vaccine is the best way to prevent the disease and prevent death from the disease. And I also echo that I think that the mandates have not. I don't know that there's anyone who wasn't going to get it that decided, who was on the fence and then said, well, now because somebody's telling me to do it, I'm not going to do it. I just think that those are decisions that are rooted much deeper than simply mandates.
Yeah, and I think also individually we do see that when a certain family or social group is affected by tragedy such as a severe hospitalization or death, that encourages people within that bubble to get vaccinated as well. So I think there are those stories going either way, Cody. Some people will become more hesitant. Some people will become more open to getting the vaccine. Overall, we just want people to continue to stay healthy. We know that communities and countries do better when they have a healthy workforce and people can be at work and be productive, and this is the best way to go about that.
Thank you.
Other questions on the line today? Wait for it. All right, so we're going to get to our YouTube and our Facebook viewers here in just a moment. So get your questions sent in because we're going to be talking about Halloween safety, poison control today, COVID. Send in all your questions from over the weekend. We know you have them. I mentioned early about Sunnye Says. This is a child series that we started about a year ago to help kids navigate through the pandemic, from how to wear a mask, how to keep your hands properly clean, to how to properly distance yourself from friends but still be friendly, to the moment that we sent our kids back to school during a pandemic. That was a tough one. There were no vaccines. It was kind of a struggle in the beginning, but we all made it through. And after all of that, we just wanted to mention that this series has been nominated for an Emmy Award and the National Share Care Award. I am especially proud. I have to say, shameless plug, this is my daughter. She worked very, very hard. And to be honest, people in this business like myself and all of my colleagues, we work our whole lifetime to be nominated for an Emmy, and here she is doing it at 8 years old. So
what kind of diva are you creating?
I have created a new diva.
8-year-old. I mean,
I have created. Thank you for mentioning it. Yes. Okay. So, she gives me a run for my money. So, if you would please, again, a mom's shameless plug, stick around and watch the end because, again, we're going to be talking about Halloween. This is our Halloween edition, and you could share this video with your kids and your friends and post it and all that good stuff. But let's get to the real experts. Not often a treat for those working ER or poison control shifts on Halloween. And then you add COVID-19 to all of this, and it makes things a whole lot tougher. While adults and teens have access to the COVID vaccine, children under the age of 12, as we know, do not. But for many families, it's trick-or-treating as normal this year. It's hard to explain why we can't send our kids out. But last year, the hotline got 51 calls on Halloween. And get this, the biggest issue, according to the Poison Control Center hotline, most of those issues come from glow sticks. So joining us this morning to talk about those glow sticks is Dr. Steven Thornton. He's the medical director of the Poison Control Center here at the University of Kansas Health System. He is also an emergency medicine doctor. And you've probably seen it all in some way or another when you work both of those type of jobs. How are you this morning, doctor?
I'm doing well. Thank you.
Good. Okay. So why glow sticks? Tell us about that.
It is glow stick season with the Halloween. And these are, fortunately, fairly non-toxic. But when they break, they have a chemical in them that can cause quite a bit of irritation to the skin, into the eye. And what you have is kind of the perfect storm, right? You have all these glow sticks, you have all these kids, and just by, just by probability, some are going to break. We occasionally get people try to eat them, things of that nature, drink them. And fortunately, like I said, ingested wise, they are pretty low toxicity. They don't cause a lot of problems, maybe a little bit of an upset stomach. But where we see the problems is people get into their eye or they get on their skin, and that can cause quite a bit of irritation. The treatment is pretty simple. It's rinse it off, rinse out the eyes, soap and water in the skin, and just expect for a little bit of irritation, but it's usually the limit of it.
So thank you for that advice. So if this happens, do parents need to call poison control or just do what you just said?
We always recommend calling the Poison Control Center. Hopefully you'll get that information as well, but kind of a do-it-yourself is you're just going to rinse it with water, irrigate the eyes out, and use soap and water for the skin.
So glow sticks, who knew? But they do look kind of appealing. They're colorful, and they look like those I always said they look kind of like those wax candies that you would bite they're really gross, but you bite the thing off and drink the liquid out of them.
Exactly. We have a saying in the Poison Control Center: never bet against kids.
They'll figure it out.
Yes, they will take no matter what you think, they will find a way to eat something, do something. And so they keep us in business.
Very good advice. Okay, so what other types of calls do you get on Halloween?
So we also get more than an average number of calls about dry ice, which some people use to make the fancy fog and whatnot, and don't appreciate how really cold it is, and we see burns from that. And there's always concerns anytime you're out there. There's parties and whatnot. Alcohol becomes an issue, particularly if drinks are left out and kids get into them and things of that nature. So we see a little bit of bump in those type calls. And then kind of the run-of-the-mill medication type problems can be a little bit exacerbated during Halloween because candy's candy. Kids think medication's candy. They'll get into them. So we'll get a little bit of a bump in those type calls as well.
Can you OD on candy and get sick enough that you need to call someone?
Well, we have a saying in the toxicology world that everything's a poison. It's just the dose that decides it. So I'm sure there's more than a few upset stomachs after Halloween with kids binging on the candy.
Yeah. All right. So you brought up a good point, though. You mentioned the alcohol, and I've noticed more and more these alcoholic beverages are becoming a little bit more kid friendly. They don't taste like alcohol. They don't look like
there's
alcohol.
a lot of bright colors, a lot of sugars. There's kind of more like mixed drinks, cocktail kind of things.
They look
out
like
there.
they're in soda cans.
Exactly, and in America, we know that binge drinking is becoming a bigger and bigger problem, and one of the triggers for binge drinking is holidays.
Yeah.
And so we see a lot more alcohol-related problems on any holiday.
And a lot of mixed families together, people leaving
Exactly,
drinks
right,
around.
right. You have parties and you got kids running around and people just don't think about it. And next thing you know, the 5-year-old downs a Jack Daniels and things aren't too good.
And that would warrant a phone call to you.
Those cases those kids are going to be pretty symptomatic, and we would appreciate a call so that we can help care for the child.
And let's talk about that, because something like that could be uncomfortable for a parent to call the poison control.
Right.
My kid just downed a Jack Daniels or some sort of medication. Walk us through that. Make parents feel comfortable that accidents do happen, and you don't. It's no judgment. We just want to make sure kids are safe.
Absolutely right. We are a nonprofit organization that is here to help anybody who calls. And we understand more maybe than anybody. Like I said, we never bet against kids. We know we've heard it all, seen it all, every story you can imagine. So you're not going to be the first, and we're just here to help you out, to help the kid, and make sure. Sometimes the child doesn't need to go to the emergency room. Sometimes the child does, and we can help give advice in both instances, and we can help the hospitals care for the children once they arrive.
What kind of injuries are you seeing in the ER on Halloween?
Well, you see, it seems like cosplay is getting more and more exotic, and the costumes are getting more and more exotic. So you see, injuries related to those. We'll occasionally see folks who are using like the makeups and things like that, and they irritate the skin, get in the eye. Those types of injuries. And then, like I said, I think it's a lot of alcohol-related injuries is not uncommon in the Halloween period.
So you're telling me that the parents could be dumber than the kids? Be honest. It's okay.
Yes, sometimes people just like to party.
Okay.
Yeah.
And they should, you
got to be careful.
Dial it back a little bit,
Right,
especially if you got kids involved.
When you're dressed up like Iron Man, you got to be careful what you drink.
Okay, and you're 40. Right. Okay. Good idea. Yeah, you're not Iron Man. I'd probably bring Dr. Hawkinson in on this one. Talk to us about having parties and just social distancing. And again, we always talk about that when there are cocktails involved and kids involved and you're getting all these families together. There's a lot of close talking. How safe is it to commingle this Halloween just with where we are with Delta?
Yeah, I think we really know those high-risk situations now. And even last year there was some real concern about trick-or-treating, although we said and certainly advocated for doing things outdoors and thought that any exposure from trick-or-treating itself was going to be pretty low because a majority of that does take place outdoors and right at the threshold of the house there. So there's not really a lot of risk there. Again, we know most of these children are probably hanging out with each other either at school or after school and other extracurricular things. So really that isn't too high risk. But having those larger parties can be high risk. We know those are high risk situations, especially indoors. You really can't control or understand exactly who is vaccinated, who had the infection recently, or who is recovering, or who could actively have it. I mean, I think we have to assume that when you get together with a large group of people, whether that's 15, 25 or more, you have to assume at least one person probably has the disease or the active infection at that point. Although the numbers and the caseloads are going down, we do know that, but putting yourself in those high-risk situations can always be a concern.
All right, so Doc Hawks, let's say I'm not vaccinated or someone isn't vaccinated or they're immunocompromised because they cannot be. They're answering a door to a bunch of unvaccinated kids. What is your advice there?
Yeah, I think doing that and just giving some candy for a very small interaction time, probably 5 or 10 seconds or less. The important thing is you can still protect yourself. Certainly face mask is going to be very important. Again, it's a very quick, short interaction. There's going to be half of that party is going to be outside. Those kids that are trick-or-treating, you'll be inside. So I think if you really want to continue to protect yourself, certainly a face mask is going to be best. If you also want to wear a face shield or eye protection with that. But again, I think what we're looking at here is half the group is outside. The group that is getting candy, that interaction is going to be very, very short-lived. But I think wearing that face mask during that interaction is probably a good idea.
Dr. Thornton, what just overall makes this just a dangerous holiday? You've seen it.
As far as dangerous goes, I think what you have is a combination of a bunch of people out at night. That's always going to raise the risk of problems. In the adult world, you have a lot of alcohol involved, so that's always a risk as well. So I think it's a combination of those two things. Though I think, quite honestly, considering the crush of people and kids out there, it's actually a fairly safe holiday overall.
And fun.
Yeah.
And kids really look for it's an outdoor holiday that I think has been very useful during a time of a pandemic.
I mean, I think it's just it's using common sense. If you're going out at night, obviously wear something with reflection, wear glow sticks, wear something where the cars can see you as far as kids. And then with adults, it's obviously consume alcohol in moderation and just try not to do stupid things.
Don't do stupid things, Dr. Thornton says. Okay, let's take some community questions because we're getting a few. And I'm going to give this first one to our guest. Isaac wants to know what portion of recent calls have been related to ivermectin or bleach?
Well,
please say not a lot.
The second part, the bleach, we get a fairly consistent number related to ingestions of bleach for, unfortunately, people trying to harm themselves or whatnot. As far as trying to treat COVID, we haven't actually seen that in a while. The ivermectin, we're getting kind of a steady stream. I think it's important when people understand that ivermectin is not a drug that the poison centers ever really got significant calls on. So any elevation in the numbers is going to look significant. So yeah, we're seeing a lot more. Are we seeing people getting really sick from it? No. Interestingly, most of the calls we get are folks who already have COVID and are on the ivermectin. So the ivermectin is not helping them out. They're still getting the COVID, and most of the problems are coming from the COVID, not from the ivermectin. So.
Okay, Dr. Hawkinson. I know there is no substitute, Julianne says, for the vaccine. I am fully vaccinated, but does vitamin D just help boost my immunity? I'm hearing a lot about vitamin D lately. Not bad, but how is it going to help when it comes to COVID or just your immunity overall?
Yeah, again, I think that a couple things. From what we have seen, the use of vitamin D in protecting you, prophylaxis, or treatment against COVID-19 really does not help. I think the same thing goes for zinc and vitamin C. And really those things and those vitamins have been looked at for decades and decades and never really shown to have a high amount of real beneficial effect for a variety of different things, and Dr. Thornton can talk to this too, vitamin C and things of that nature. So I think when you are taking these over-the-counter supplements, doing it in the recommended daily doses will not have any harm, but I really don't believe that the benefit is there. And certainly for certain things, vitamin C, vitamin D, and zinc in particular, the trials have shown no benefit in whether protecting yourself from the infection or once you do have it to treat the infection. Now again, certainly people who want to overall have a healthy lifestyle can certainly take these supplements in the recommended daily doses, but for the purposes of prophylaxis and treatment against COVID-19, they haven't really shown any benefit.
And just to follow up to that, what about melatonin?
The same thing. I mean, people are looking for utilization of drugs that are okayed or authorized or used for one thing and really turning it to COVID. And really what we have seen, besides steroids essentially, is that none of these, especially over-the-counter drugs, have shown really any benefit in protection or treatment against COVID-19.
Okay, I brought up the I word, ivermectin. So now Kip is asking, what is ivermectin used for in humans the proper way? Who wants to answer that?
I think I'll let the infectious disease
Okay.
doctor answer that one.
Certainly it is a very good drug when used for the reason that it's supposed to be used, such as parasites. There's one infection, an intestinal infection called strongyloides. So there are parasitic infections. There are real uses for it, and it is beneficial. But for this viral infection, despite what this basic science lab initially showed, and that you have some reduction in the viral load. But that could be for a number of reasons when you're looking at benchtop research, and that happens every day with all kinds of compounds. But it's really the issue of bringing it to market for the actual benefit that you see in that basic science research lab. And so far, ivermectin has not been shown to do that. But again, we certainly welcome the data from properly conducted trials for that. But otherwise, for its normal authorization or normal use, such as parasitic infections in animals or humans, ivermectin is a very good drug.
Tanya wants to know, have you heard when the general population will be eligible for boosters? She's 53. She got her vaccine back in March. When might she be able to jump in there and get her
Well,
booster?
certainly for Pfizer, you are able to, if you fall into that high-risk category. But again, I think there is a lot of vagueness there. I think it does include, it is a large umbrella that includes a large amount of people or subpopulations within the populations. And for Moderna and Johnson & Johnson, we are waiting for ACIP to make their recommendations. We know that the FDA committee made their recommendations last week. We'll see what the final recommendations are for ACIP. I believe it's really going to be probably quite similar to what the Pfizer is, just to help stop in that confusion. So, but the other reality is that we have a glut of supply of vaccine in the United States, unfortunately. We would still like people to go get their first and second doses, but certainly wanting the booster or the additional dosing, we know that people have the ability to walk into private clinics and or private pharmacies and really get dosed as they want to.
Gretchen wants to know, could the doctors please weigh in on this? How long till an mRNA booster might be available for J&J? She received it in March, and I'm a woman in my 40s with a blood clotting disorder. I would rather just wait for a different booster. What advice do you have?
So we know that from some English studies looking at the AstraZeneca vaccine and then getting the mRNA vaccine, you seem to have really, really good, robust protection from both the B cells and T cells when getting dosed like that. What she is talking about is mixed dosing or heterologous dosing, which is basically you have one company or one platform, which is the adenovirus, the Johnson & Johnson, and then you mix it with an mRNA vaccine. I believe ACIP will be meeting on that to talk about that as well. So just hold tight and wait for that information. But what they did show in England in those early studies, and we don't have AstraZeneca here right now, we just have the Johnson & Johnson, which is very similar, it did show that you do have very good protection when mixing that first AstraZeneca or adenovirus vector platform, which is like Johnson & Johnson, and then giving that mRNA platform. So we know that it does provide good protection. We'll just have to wait and see what the ACIP, the committee, recommends for people here in the United States with Johnson & Johnson, and then possibly getting that mRNA platform vaccine.
Dr. Thornton, you're up. Okay, so Janet has a question, and I'm glad she asked it because it's about the difference between what older people need to call the poison control for and what younger people what it's called for younger people. I remember when I was younger, my introduction to poison control was when I was babysitting. They would have like a sticker put up on their refrigerator that says, call poison control if anything happens to my little kids. So we always think of it for little ones. But if I'm a caretaker of an older person, what kind of things do I need to be looking at in the house to keep them safe?
Well, I mean, it almost all comes down to medications for both the younger and older. In the younger population, obviously, we see kids get into medications they shouldn't be in at all. They find bottles and whatnot. In the older population, we get a lot of calls on double dosing, like they forget they took their morning, so they take another dose and whatnot. And of course, they can be on a lot of medications, so. That's probably the one where we help out our more elderly, older population in regards to phone calls is what happens when you mix this, and this, and you take double that. We see a lot of polypharmacy, and those can be really complicated cases depending on the mixture of medications.
Other than medications, anything we should just anything they might ingest, put on their bodies, anything that we need to keep an eye out for?
It's going to typically be ingestion of the medications. Okay. Like I said, during Halloween, there's a lot of mistakes between medications and candies. Some of them can look very similar, so we see that a lot of times with kids. So it just comes down to controlling your medications and treating them with respect.
Okay, Dr. Hawkinson, Michaela says my husband finally got his first shot in April. Now he says he won't get his booster. How do I convince him to get a booster, or should she just be happy he got one at all at this point?
I mean, certainly be happy that he got one. We know that the best protection comes from that second dose of mRNA vaccine. Obviously, if you have Johnson & Johnson, it's just that single dose with now a recommended booster at the end. I think it's just continuing to talk to him and don't really understand the reasons. We know that there are several that are common that people don't want to get the vaccine, but just would encourage to offer greatest protection. Now, if he had the infection a while ago and then got one dose, some people think that may be okay. But what we have learned is that the vaccines really do provide the best way for your immune response to continue to evolve and work out. And we saw that people who have gotten vaccinated with 2 doses of the vaccine seem to develop those antibodies and those neutralizing antibodies better than those people who are unvaccinated and did get the infection itself. And this is those neutralizing antibodies to all of the variants of concern. Those ones that we do know about, but also likely those ones that we don't even know about yet that haven't really arisen. So again, just I think keep talking and understanding and answering questions, or get those questions that he has answered. But we know that getting those that second dose of the mRNA vaccine really leads to a lot better immune response as far as broad neutralizing antibody activity, especially to those variants of concern.
Joe wants to know, she's 6 months out from her second Moderna, so I will be available when approved, she says, but she's also due to get her mammogram in about a month. And I remember we talked about this last week when we had our breast oncologist on she said she remembers something about the timing between those. Does that matter? Can you remember what they said about that?
Yeah, I think our breast imaging docs and surgeons understand the reactions and do understand that people who have gotten the vaccine will have enlarged lymph nodes. They do take that into account, and so I don't really think that from a standpoint in a day-to-day action that's going to be difficult, and it shouldn't really change your processes at all because they are now. I do have that experience in reading those mammograms in those people that have gotten those vaccines, so I don't really believe that will be a big deal. And instead, what they would like, and what we have heard about, especially last week, is go get that screening. Do not delay your screening. So you can always mention that when you go to get your mammogram. They can put it in the notes, but the biggest thing is really to get screened.
Good to know. Okay, Marianne says, if someone is fully vaccinated and has their booster and gets COVID for the second time, is their viral load as strong as it was the first time they had COVID before getting the vaccine and the boosters?
So there's a little bit of information about this. This general scenario, and the fact is what we are seeing from a small published study is really that 3 months after that third dose, you really have maximal protection. And so even with Delta, you are looking to have decreased viral load and even have that viral load shed for a less amount of time. There is one study looking at Alpha versus Delta, and what they saw that those reductions in viral load were much less when people had Delta compared to Alpha, even after vaccination. However, within that first 3 months, it is about the same. But those benefits really do decline after that 3 months. However, you are still protected from the overall disease process. So, certainly within that first few months, you are extremely well protected. And that's why it's important, I think, to maybe time some of these. I don't think everybody needs the booster or needs additional dosing. But now as we're getting into the holiday season and people are gathering, it may be okay to start timing that in that way to help provide maximal benefit and protection so that you may not spread it to some of your friends and family that may be in some of that immune compromised situations who may be more at risk of that severe disease as well.
Holly asks, can you tell me the requirements to receive monoclonal antibodies? And here's why. She has 2 friends that both tested positive, non-vaccinated. One was able to receive the antibodies. The other was not a candidate. She also says, thanks for all of our doctors do. But please answer her question.
Yeah, and I'll have Dr. Thornton jump in too as well. So we are able to give the monoclonal antibodies at our infusion center. We also do some in the emergency department. Really, the categories for getting even looked at and screened for getting monoclonal antibody is certainly age. You have to be over 12 and over a certain weight, and that's, I think, 100 pounds or something similar to that. But then we also do break it down into other criteria because we are looking to prevent hospitalization in those most severe or at risk. So age does play a part in some of that criteria, as well as comorbid conditions, especially immunosuppression and things of that nature. We have this active screening process that we do here at the hospital. And through this whole time that we have been available to give the monoclonal antibodies, some of the criteria have differed just as the process has evolved. But I think that goes to, again, the screeners who are doing those with the criteria, looking at that, seeing who is the most at risk of hospitalization, and that could be one reason. I don't know if Dr. Thornton has
I mean, it could have been as simple as the criteria changed between the two, with the 2 patients. But in general, like Dr. Hodgson is saying, we're looking at patients who are at risk for getting really, really sick. It's kind of like you're looking for a Goldilocks kind of thing, just not too cold, not too hot, just kind of right. And so it very well may be that one of her friends fell, out of the criteria, or like I said, the criteria changed between the 2.
Yeah.
So,
but it is age, comorbid conditions like immunosuppressive therapy, diabetes, heart disease, lung disease, obesity, things of that nature. So there are different criteria depending on also what age. Are you 65 and over? Are you under 65? Things of that nature.
Dr. Thornton, I know you specialize in toxicology, but also emergency medicine. What are you seeing as far as COVID? You said not as many cases, but
we continue to see cases, but they're definitely declining, and I think that's reflected by the numbers in the health system. We continue to see, I mean, I wouldn't say universally, but 95% are not vaccinated who present with serious disease. And overall, I think we are definitely seeing a decline. And I think at this point it's an opportunity for us to stay ahead of it and continue to keep it declining, and hopefully we won't have any more surge.
Dr. Hawkinson, Kim said she reached out to Hy-Vee to get scheduled for her flu shot and her Pfizer booster shot, but the pharmacist suggested not getting them done at the same time. But she says she's heard it right here from you that that's okay to do. What should she do with that?
Yeah, again, we're getting into late October now. I think it's a good time to go get your influenza vaccine. This will help you maintain that good immunity through the rest of influenza season, through April and whatnot. So Unfortunately, I think that's bad advice by the pharmacist. We know that it's okay to give both vaccines at the same visit. And again, we never want to miss an opportunity to vaccinate.
So she wants to know, why would they say that? Do you know?
I can't explain why somebody would offer that. Maybe there were other points in that conversation. But overall, we know the recommendation is that you can get both influenza vaccine and COVID-19 vaccine at the same visit. So.
All right. Dr. Hawkinson, Marnie wants to know, how should she handle my kids going door to door at Halloween? Everyone's running up there. They're all squished in together. What advice do you have for her?
Again, I think if you can maintain a little bit of distance, we know it's difficult for kids to do that outside, but more than likely these kids have been getting together for quite some time in school, after school extracurricular activities. And again, trick-or-treating itself, you're doing outdoors. And we've always certainly been an advocate of doing things outdoors and being active, whether it's walking in the park or even going to things like the K or Arrowhead and being outdoors and doing that, because we know the risk is less. And so I really think that situation where you are going door to door and you are outside for that majority of the time is really low risk. In addition, some people may have masks on just because of the costume itself, so that may help as well. So overall, I think it's low risk compared to everything else that is going on.
Question about monoclonal antibodies. Brian says, if someone receives them, do they need to wait to receive other vaccines, even just besides the COVID vaccine?
There's no indication to wait for other vaccines, but for COVID-19 vaccines, you should wait 90 days from getting that monoclonal antibody.
Georgianne wants to know, would you talk a little bit about immunity from COVID versus the vaccine? As businesses are requiring vaccinations, she has a friend that refers to her natural immunity from COVID rather than getting the vaccine. What are your thoughts?
Yeah, I mean, I think this is a point of consternation for a lot of people who are in those institutions or areas where there is mandated vaccines, even though they've had COVID-19. You know, we really don't know clinically. We know that overall reinfection is low, and we have seen that prior to the vaccine. Also, after the vaccine was released, we know, however, that vaccination does lower your risk of reinfection. We saw that in an MMWR from the CDC, looking at a cohort in Kentucky as well, that vaccination after infection does reduce your risk of reinfection. In addition, we know that there is a growing body of evidence that shows that people who have gotten vaccinated with at least one dose after infection do have higher antibody levels, at least, compared to people who just had infection, and even compared to people who both had 2 doses of vaccine. In addition, we know that that additional dose of vaccine after infection, like I stated before, is going to increase your B cell and T cell immune response and create further neutralizing antibodies to those variants of concern, those ones that we know about already and those ones that we probably don't know about yet. So really the best advice is, even after infection, and again, this is the CDC advice, even after you've had the infection, you should get the vaccine.
A few more questions. I don't know if you can answer this, Dr. Hawkinson, and maybe we can find out for Lori, but she wants to know, what is the prevalence of vitamin D deficiency in Kansas and Missouri? Just any insight you can give on that?
Yeah, I think you'd probably have to ask my primary care internal medicine colleagues like Brandon Comfort. We know that in general, probably in the northern latitudes, and maybe Dr. Thornton can speak to this as well, that a lot of the population has vitamin D deficiency based on that lab value. What is the clinical effects? We know vitamin D is extremely important for bone health and things of that nature, but I don't have the numbers off the top of my head on the full amount or the prevalence of vitamin D deficiency.
Yeah, I would agree that there's a lot of people that are diagnosed as deficient based off a lab value, but clinically I don't think that we see a lot of what would consider significant vitamin D deficiency.
Yeah, I'll see if I can get that answer. Maybe even our endocrine colleagues can probably help answer
And I
that.
know Dr. Comfort's going to be on here in the next week or so, and this might be a question for him also. Dr. Hawkinson, Melanie has this question. Maybe you could just help her out with it in the meantime.
Yeah.
She said a friend of hers, their 20-something-year-old son is 6 weeks into symptoms that include fevers. He had COVID, so he has fevers. He did contact our long haul clinic, but he was not admitted because he's not 12 weeks out from symptoms.
Yeah.
So he did not meet the requirements yet. But her question is, are fevers common with long haul symptoms? And is there anything else clinically that this family can do for their son in the meantime? until maybe he can get into a long haul clinic.
Yeah, I guess I would ask, what are we using for the criteria for saying fevers? Is it subjective? Are you just feeling hot? Are you actually taking the temperature? What is that exact temperature? But in general, I haven't heard that for long haul symptoms necessarily, true fever is an actual symptom or a sign of continued long haul symptom. The most common symptoms that we hear of for long haul, again, headache, fatigue or brain fog, cough, shortness of breath, and weakness really tend to be the most common long haul symptoms. I haven't necessarily heard of fever, but I would like to get further details on exactly what are you calling fever. Again, are you just feeling hot, or is there actual objective data showing that your temperature is above that fever threshold?
And is that good news in the fact that maybe because he has not reached that 12 weeks, that maybe this will wane and go away? That this is just kind of it ridding itself out of the body, and there will be no long haul?
I mean, certainly we would hope by 12 weeks some of those symptoms that are still persistent at 2, 3, 4, 6 weeks after the infection would resolve, and that's why we do have that criteria of long haul syndrome being 12 weeks from that acute infection. Would certainly hope so, but again, time will tell.
Okay, I'm just looking through to make sure I got everybody's question. If I did not get them, I'll hold on to them. We'll ask them later on this week with some of our other experts. So let's get to our final thoughts. Dr. Thornton, I'm going to start with you. Good to have you today.
Thank you.
What do you want us to know? We've got Halloween coming up. We just want to keep everyone safe, and just in general.
Yeah, like I said, I think the keys are obviously it's taking place at night, so make sure that your children are visible. Make sure that with the glow sticks that you understand that they can be irritating, but they're generally not very toxic. And of course, for the adults, just remember that alcohol in moderation is the key, and always kind of think before you drink.
Good advice. Is poison control underutilized? Do you wish people would use it more often? Are people using it the way they should? Do they need to be calling more often?
So I think that we are maybe not thought about enough when you're dealing with situations in the home. We can help a lot of times prevent an emergency department visit. And so, and like I said, we're 24/7. We're always happy to help. And any indication, give us a call, and we'll see what we can do for you.
So get that number back up on your refrigerator.
Exactly.
And use it. Okay, will do. All right, Dr. Hawkinson, final thoughts. It's Monday. Send us out into the week with a good thought.
Lots of good information last week on the FDA committees looking at boosters for Moderna and Johnson & Johnson, and we know that people who got those 2 vaccines were kind of waiting for that. We'll wait for the final ACIP recommendations coming up within this week here and kind of go from there. Overall, continue to get vaccinated. We know that cases had been going down. I saw in other headlines where certain areas, they may be ticking back up a little bit. I think we are at a great place now to get those vaccine hesitant people and those people who haven't received vaccines, get them vaccinated so we can provide maximum benefit and protection, especially now as we're getting into colder seasons and the people will want to be meeting indoors, holiday get-togethers and things of that nature. This will provide maximal protection and especially keep those groups of people and those subpopulations who are most at risk of severe disease, keep them protected as well. We know that's going to be so vitally important moving forward. We've already had so many excess deaths and excess illness in the United States with the pandemic. We have a way to prevent it. Let's continue to promote that and get that done.
Okay, can we rewind really quick? Because Melanie got back with me, and she said those fevers are about 100 to 102 on that kid that is in his 20s. Anything to add to that?
100.2 or 102?
100.6 to 102.
Okay. Yeah, I mean, I certainly wouldn't expect fevers, but again, hopefully those will go away and certainly can get in just to make sure there's nothing else going on. It is probably not feel too well for that patient that is having those fevers on a daily basis. You can take some fever reducer. Always, also, if you need to get into a physician to get a medical evaluation. Make sure there isn't something else also going on.
All right. Thanks for answering that follow-up question. She got back with me. So, okay, everyone, we're going to wrap up the show here in just a moment, but thanks for staying with us again. Yes.
So I did get the answer from an endocrine colleague
okay.
about the vitamin D
Okay.
deficiency. So it sounds like nearly half in the U.S. So it's pretty prevalent.
So it's not just us here
It's not
not
just
getting
us
enough
here.
sun. We always feel like we're not getting enough sun, so it's
And
not
probably
just us.
about 45% is reasonable for Kansas.
Okay, interesting. All right. Okay, so now we would thank everyone for being with us. I mentioned Sunnye earlier, my shameless plug for my daughter, but Sunnye Says is back with the latest edition of Sunnye Says. So this time it's Halloween safety. That's what we're talking about today. You can share this with friends and family to keep you and your friends safe on this favorite holiday of the season. Just take a look.
Hi friends, it's Sunnye. Halloween is one of my favorite holidays, and I'm sure it's one of yours too. But before we head out to get all that yummy candy, let's go over a few rules to keep you safe and healthy. First things first, Sunnye says, make sure your costume fits just right so you can see really well and you don't trip or fall. If you use face paint or makeup, make sure it's non-toxic. If you don't know, just ask an adult.
That should be enough.
Glow sticks can be fun and festive, but keep them out of your mouth. Dry ice is so cool, but Sunnye says don't touch it with your bare hands. It's ice cold, but it can burn. It's fun to trick or treat with friends, and it's safer too.
Trick or treat!
But Sunnye says make sure kids and parents understand the social distance and masking rules in your group. Make sure to look both ways crossing the street. Have your adults put reflective tape on your costume. Sunnye says it's really important that cars can see you. Only go to houses that are well lit. And Sunnye says if you get a homemade treat from a stranger, politely say thank you, but don't eat it. Only eat candy you recognize in wrappers. Remind your adult to keep medications out of sight this time of year. Kids are in treat mode and will eat anything, especially my little brother. Sunnye says adults should put the poison control number in their phone just in case of an emergency. It's the same number for the whole United States. Sunnye says have fun, be kind, be safe, and go get that candy.
Good. Was that good, Dr. Thornton? Okay.
Cuteness overload.
Hashtag. All right. I just had to make sure that was Dr. Thornton approved. Okay, everyone. Thank you so much for being with us today. We really appreciate it. And you can call this a family affair. A mother and daughter discovered a gene that means breast cancer runs in their family. This comes as they both battle the potentially deadly disease. But it's not just women who have the gene. Men do too. We're going to take a look at how our survivorship and high-risk program here at the health system is helping to save lives. And of course, don't forget, you can catch our show here every single day, anytime on Facebook and YouTube. We will see you tomorrow at 8. Make it a great Monday.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.